Do you know if you have high blood pressure? Measurement of blood pressure at home is of more help in knowing if you are at high risk for a heart attack, stroke, heart failure, kidney failure, or dementia than blood pressure measurement taken in a doctor's office. Home measurement of blood pressure can help a healthcare professional know whether you have normal or high blood pressure and can help you control your blood pressure. Whether you are concerned about high blood pressure or currently have it, this video will help you decide if home blood pressure measurement is right for you. And if it is, this video will teach you how to do it properly. Remember, if you have any questions about home measurement of blood pressure, or you are unsure whether it is right for you, consult your healthcare professional. Experts believe if you are at risk for high blood pressure, you should measure your blood pressure at home. Now, taking your blood pressure at home in combination with blood pressure measurement in a healthcare professional's office can help signal if you have normal or high blood pressure, if you have a serious medical condition, and in turn, assist your healthcare professional in finding the appropriate treatments for you. Home measurement will also help you and your healthcare professional monitor your blood pressure as your lifestyle or your medication changes. Among the conditions home blood pressure measurement can help signal is white coat hypertension. This occurs when a person's blood pressure will be high when they see a healthcare professional, but will be normal at home. People with white coat hypertension do not have a higher risk of heart disease or stroke, but over time, some will develop true high blood pressure. Making good lifestyle changes can prevent high blood pressure from occurring. By continuing to measure blood pressure at home, people with white coat hypertension can help their healthcare professionals know if or when true high blood pressure develops. Another condition home blood pressure measurement can help signal is masked hypertension. This is the case with people whose blood pressure is normal when they see a healthcare professional, but is high at other times. People with masked hypertension do have a higher risk of heart disease and stroke, so they should continue to measure their blood pressure at home to help them and their healthcare professional determine if their blood pressure stays high. Regularly measuring your blood pressure at home is a great way to monitor your health. And for those of you with hypertension who sometimes forget to take their medication, it's a good reminder to take your medication to keep your blood pressure down. Make sure to contact your healthcare professional if your blood pressure readings are high. Most people can properly measure their blood pressure at home. For some, however, home blood pressure measurement makes them very nervous, or it may be a complicated task. It can be difficult for people with physical or mental disabilities, for instance. But friends, family members, or other caregivers can help. And some people with irregular heartbeats, such as atrial fibrillation, may have difficulty obtaining accurate blood pressure readings. If you have diabetes or kidney disease and want to measure your blood pressure at home, consult your healthcare professional. Sometimes your healthcare professional may also want to measure your blood pressure with a special monitor that you wear for a full day and night. These monitors can take about 50 readings in 24 hours and can help determine if your blood pressure is too high. If home blood pressure measurement makes you nervous, or if you have an irregular heartbeat, diabetes, or kidney disease, discuss this with your healthcare professional before purchasing a home measurement device. Blood pressure goes up and down depending on how you feel and your amount of physical activity. While these changes are normal, they can result in high blood pressure readings that mislead you. In order to determine if you have hypertension, your blood pressure should be properly measured at home when you're in a relaxed state. We will review the ideal conditions in which to take your blood pressure shortly. The first step towards measuring your blood pressure at home is purchasing a validated monitor. Newer types of equipment have made home blood pressure measurement not only easier, but more accurate than in the past. Next, you need to choose the right cuff size for your device. And finally, you must prepare for and measure your blood pressure properly. It is important to make sure you measure blood pressure properly so that your readings are accurate. Accurate reading measurements ensure your healthcare professional prescribes the most appropriate medications to help control your blood pressure. When blood pressure is not controlled, your risk of heart disease and stroke are markedly increased. If too many medications are prescribed, you may experience side effects. If your blood pressure changes often because you do not measure it properly, this will make it difficult to tell what your blood pressure usually is. In the next segment, we will show you how to choose the right equipment and accurately measure your blood pressure at home.